Hello everyone, myself Dr. Himanshu Dave and I am here with a video including minor details about Pdcet counseling. I am getting phone calls almost daily from many of the students and I am sorry that I am a bit late. And first of all, congratulations to all the students who have qualified and have achieved good result in the Pdcet 2023. Okay, so few important aspects of the Pdcet counseling. Now, first of all, we will have a look about the Pdcet 2022 counseling first round. These are the closing ranks and the closing ranks of the unreserved category. This list is branch wise, and I have included the closing rank of first round only because one thing I would like to tell you about the counseling of Pdcet that not major differences occurs in first, second, and third round. So the high probability of getting a seat, especially for UA category, is in the first round only. In the next rounds, there is very less shifting because in Pdcet, those who are trying and those who are writing the exam after diploma, only those guys are writing the exam who are really interested in opting a seat. So the changes in the closing ranks are not too much. For example, in anesthesia, the closing rank was 188 in the first round, and in the second round it was 189 only. So the difference was not much. So I've included only for the first round. So for anesthesia it was 188. For dermatology it was 11. Is very less number of students apply for dermatology. Obstetric and gynecology, the closing rank was 348. Ophthalmology 142, orthopedics 106, pediatrics 323, pathology 39, psychiatry 19, radiodiagnosis 71, and respiratory medicine 42. So the major branches of the Pdcet, that is the post diploma DNB, are anesthesia, obstetric and gynecology, ophthalmology, orthopedics, pediatrics. As many number of students are there and the number of seats are also good. So this is the closing rank for the Pdcet first round, and changes in the second round was not too much. For the reserved category students, I would like to say that you really can't judge that at what rank which seat is going to be available in the rounds of counselings, because there are very less number of seats. Only in the few government medical colleges or hospitals or like railway hospitals there are seats reserved in DNB or this Pdcet counselling. So it's very much luck dependent thing that how many of the category students are there this time. So it depends and it varies. You can see the allotment list is available on the netboard website, and I have also shared in the WhatsApp group. Okay, so this is this was a major scenario last year, and a comparable scenario will be there this time also. But yeah, one thing you should keep in mind that the number of students were a little less this time who have applied for Pdcet. So the competition is a bit less this time, so there are high chances of getting seats, and seats are increasing day by day. So it's a good news for you guys that at this time, in my opinion, many of the students are going to get a good seat. Okay, so now next point, what was the process of Pdcet 2022 counseling? Now this is a very important slide because this will give you a rough idea that how much it takes from the declaration of result and the completion of counseling. So the result was declared on 24th of August, and first round allotment was on 8th of October, second round allotment on 27th of October, and third round was on 16th of November. So almost 1.5 months was there from counseling to first round. So approximate this is the time which Pdcet usually takes, and it also varies. There is no fixed criteria about the counseling that after these many days counseling will start. Sometimes it takes more time, sometimes it takes less time, but on an average we can consider that 1.5 to 2 months will be definitely there between the declaration of result and commencement of counseling. And okay, so this was last year's scenario. Now the important point about this year or for any of the counseling is that how to choose the institute. This is the very important part. Now there are two categories of students, one who have done their diploma from government institutes and the other one who have done from other private or so first of all we will look about this, that who has done diploma from government institutes with heavy workload. Okay, not only government, if you have done with any private or trust hospitals where workload was very nice, so for those students, you can go for good and famous private corporate hospitals with average patient load. Private hospital doesn't mean that patient load should be very less, patient load should be average. Hospitals should have quality work, that is, all the major investigations or new guidelines should be followed there. For example, if you are going for pediatrics, then all genetic testing and everything should be available, or at least a good number of investigations and treatment facilities should be there. And if super specialty facilities are also available, then uh, that is a very nice aspect. Okay, and overall the workload should be decent, not very heavy labor like work should be there, because you have if you have already done from institute with heavy workload, then you have seen many number of cases, and now the things which were missing was quality work. So you have dealt with the quantity already, so you should definitely try to get institute in which the quality work is given more priority. So this is for those students. Now the other category of students are those who have done their diploma from institutes with less patient load or less free hands, especially for surgical branches. They should definitely go for government medical colleges, should be their first priority, then government hospitals with heavy patient load, or any trust hospitals with good patient load. I am not saying that you should not go for private, but definitely you should first confirm that the hospital which you are going to join should have at least a good number of patients, so that you may get a good exposure. Okay, so these two categories, different priorities, and it depends definitely on your background, that you have done diploma from which hospital and how much exposure you have achieved. Now overall priorities, if we go, just a minute. So I'm sorry. Okay, now coming to this slide again. So overall priorities, medical college benefits. Now what are the benefits of the medical college? Medical college have all the departments, so you will get a thorough experience of everything. Now what I mean with all the departments and thorough experience means, now like if you have joined institute where only pediatric, the hospital is only of pediatric and gynecology, and so there is no department of ophthalmology, no anesthesia department, no orthopedics, nothing. So now if you are having a patient and there is some neuro-ophthalmological finding or any ophthalmological investigation is required, and you are not having any specialist of that branch in your hospital, then definitely you are going to miss that experience. So in medical colleges there are all the branches. The other benefit is you are getting definitely a decent workload, and the teachers are also quite well experienced and good at academics. And the third important benefit is that all the government medical or medical colleges are mostly more than 500 bedded. So this 500 bed hospital is another criteria for DNB institute selection, that for if you have done DNB from more than 500 bed hospitals, then for becoming assistant professor in government medical college you have to do SRship of only 1 year. But if you are doing from less than 500 bedded hospitals, then 2 year SRship is required. So you should go through these guidelines in detail. These are available on NetBoard website. Now at least 2 seats should be there. This is my personal opinion. It's not hard and fast. You can definitely go with the college where only 1 seat is available in a particular branch, but with 2 seats I mean to say that you should have uh, your colleague or partner, so that you can definitely spend your 2 years nicely discussing things, and it will be definitely beneficial for you guys in doing theses and all other works, and especially during the exam time. So this is a point, but not mandatory. And other thing also, that it should be your batch should not be the first batch. Now these points are especially for those students who have achieved very nice rank and they have all the options in their hands. So for them especially, while making the priority list, they should keep this in points. And if your rank is not too good, and anyhow you have to take a seat this time, then these 2 points are not that much important for you. Okay, but these points are definitely important. And 500 bed point is really a very important one, but that too, if you have too many choices in your hand. If you are not having much choices, then you can even definitely go through the institute with less than 500 band. But if all other points are in favor, then definitely you can choose that institute. Okay, now the dilemma for the post diploma guys, everyone who has done diploma already are facing these things. Stipend, this is the very important and the major determinant for, I think, almost 60 to 70% of the guys. uh, so a good and decent stipend should be there, because if you are managing a family and you have family responsibilities, then definitely a good amount of money should be there. So just try to gather information about the stipend in different states. Now the guidelines of net board says that the stipend should be equal to what the stipend that particular state is paying in their medical colleges, but it's not same everywhere. The stipend of government hospitals are almost similar to the MD or MS students of that particular state, but in some private institutes they are paying less. So just confirm before joining. And family responsibilities are definitely there, you can't deny the family responsibilities. So you have to choose sometime the institute in your state only, your parental state. Like if you are from Maharashtra or if you are from Delhi, then definitely your priority is to choose the hospital in that state. So this is another factor. And age factor, definitely you have already done MBBS and diploma, 1 or 2 years were already spent here and there during NEET PG preparation. And now also many of the students have not joined just or are not going to join just after their diploma. 1 or 2 years they have done job anywhere. So age factor is there and you can't cope up with heavy workload. So choose very very wisely. It should not happen that you have joined institute without getting much knowledge about the institute or the workload. And if the workload is very much there and you are not able to cope up and then you are going to leave in between, this should not happen. Okay, so choose wisely. Just assess yourself that how much capacity you have, and if you are in a mental state that you are not able to do much work, so then definitely choose the institute as per your requirements. So these are few of important points, and for all other questions I am definitely ready and willing to help you. So you can just type in the comment box and whatever query or confusions you are having about the counseling and anything. And in the future also I will try to share other videos and try to help you guys. Okay, so all the very best for the counseling. And as the counseling process will start, we will again discuss and with some other videos about the different hospitals in different states. Okay, so you can subscribe my channel with this handle on the YouTube at Shishu Care. Thank you very much. All the very best.